Welcome to the Health Science Podcast, sponsored by the National Health Association. I'm your host, Dr. Frank Sabatino, and today I'm delighted to have as my guest, Dr. Kerry O'Connor. Dr. O'Connor is an osteopathic physician, board certified in family medicine, also a diplomate in the American College of both Obesity and Lifestyle Medicine. Also has a medical nutrition certificate from Columbia University. Worked also with a healthcare fellow at Duke, member of the Love.Life Telehealth service, where she spends a lot of time helping people apply plant-based living to really solving major medical concerns and issues. Welcome, Dr. O'Connor.
Welcome to the Health Science Podcast, brought to you by the National Health Association, the oldest organization in the world championing the extraordinary benefits of a whole plant food diet and healthy lifestyle, as well as water-only fasting. We believe that health results from healthful living and focus on evidence-based science that promotes the health of you and your loved ones, as well as the health of all animals and the environment. We feature experts from a cross-section of disciplines within the plant nutrition, vegan, psychological, environmental, and animal compassion sectors. I'm your host, Dr. Frank Sabatino, the NHA's Director of Health Education.
Dr. Sabatino, thank you so much. It's a great honor to be here.
Yeah, and it's my pleasure. You know, when I go into your background, I noticed that your kind of introduction or connection to plant-based living kind of happened a little bit later in your professional life. Is that true, or did you have some inclination and motivations earlier before you even went to medical school to look at plant-based living or any of that?
So I had some inclinations to just lead a healthier lifestyle many years before I went to medical school, and medical school was a second career for me. But it really solidified when I was in the military. And for me, it wasn't, in my particular case, at the time, it wasn't particularly for health reasons. And I had always been a pretty good athlete. And when I'd lived overseas for a number of years and really kind of learned how to train and kind of hone my skills as an athlete. And I'd followed some plant-based athletes like Rich Roll and Scott Burek. And I quite frankly thought that, I'm like, there's nothing to this. They're crazy. And it was August of 2013, and I had gone on vacation in Edinburgh, Scotland. And when I landed, I said, well, if I'm going to go plant-based, I'm going to start it now and see if I can do it. It made for a really interesting week in Edinburgh. You can find plenty of plant-based foods there. And
where they do fried Oreos, which I know is really one of the specialties in Scotland. Right.
And which I didn't have when I was there. Although if I go back, oh, no, I'm just kidding. And I started there, and I just never went back. I started my journey of researching a little bit more about the plant-based lifestyle, took some plant-based cooking classes. I really didn't know how to cook at the time. And then graduated into, when I came back to the States, the T. Colin Campbell certificate in plant-based nutrition. Columbia University had offered a certificate in medical nutrition therapy. And, I just went a little bit deeper, although that was not a 100% whole food plant-based program. We did talk a lot about that. So thankful for that foundation. And then it just grown from there.
Let me understand the timeline, though, a little bit. When I read your bio, I got the impression that you had enlisted in the Army. Were you already a physician at that point?
I was.
So you were an Army physician at that point?
Yes, I was.
And you made the point that the Army stint played a kind of a significant role in driving your passion for plant-based living and lifestyle change. Is that true?
That is true.
And tell me that story. Why? How did that transpire?
Well, I would see, first of all, on most Army bases, there's, other than at the commissary, or if you can go off base, the foods are not the healthiest. There's a lot of fast foods. And oftentimes, at least in the case when I was living overseas, there are some families that literally never go off base. They don't have a chance to participate in the local culture or local food. And oftentimes it's by choice. It may be out of fear, maybe for some other cultural reasons. But a lot of the food that's available is not the healthiest. I think since my time in the military, things are changing with the dining facilities. They're getting a little bit better. But I would see families and kids and service members with significant overweight and obesity issues, When I got off active duty, I went back to Germany and I worked as a federal employee at a similar Army clinic. And I had done a little bit of a study. Myself and my medic, we just for about a month, we kept stats on people's BMIs when they came in, and it was their family members as well as the service members. And there was a 60% rate of overweight and obesity in people in uniform and 61% in their family members. So there's a readiness issue for our security, for our defense, and that's been known for a while. But it was just seeing how unhealthy the families were and how stressed they were that I began to really dig into it more and more when I was on active duty in 2013.
So as woeful as the typical medical education is in training doctors to be nothing more than disease managers in many ways, I get the impression the Army medical system was even worse.
Correct.
In many ways. It was even much more entrenched into kind of old ways of thinking and treating and all of that.
Correct. Yes, that is correct. And I, although individually, as within any system, there are some stellar actors and players, it's up to you as an individual to seek it out on your own, right? And oftentimes there's not support by administration or by command or whomever. And it's an uphill battle, but it's one I'm very passionate about.
You know, it's an aside, but I know that you went to Kirksville, which is a really well-established, very old osteopathic medical facility. And, you know, historically, osteopathy had such a long history of physical manipulative medicine. And my impression was that Kirksville still kind of taught some of that. Was that part of your education when you were there?
It was, yes. And it's a foundation that the neuromuscular medicine part of it, I've not kept up. Oftentimes when you're in your specialty, there's not a lot of time, and insurance companies may or may not cover it because it takes a fair bit of time. But the foundation and the roots of osteopathy, I've never strayed from. And A.T. Still, who was an allopathic physician, he was an MD, started Kirksville College of Osteopathic Medicine, now A.T. Still University. And it really, one of the founding tenets is mind, body, spirit, and the body has a tremendous ability to heal itself. We just need to get out of the way. But there's so much in our lives and our modern lifestyle now that's in the way that doesn't allow our bodies to heal. We just need to clean the slate. So the principles I stand by every day, and I'm so appreciative for the education.
Yeah, it's great. You know, when going through chiropractic college the way that I did, I went into a lot of that literature, and one of the really premier researchers, and I think he was connected with Kirksville for a while, was Dr. Korr, Korr, who did amazing research in physical medicine of that kind. So yeah, it's a great tradition. It's an important history, and it was great that you got exposed to that.
Yes.
I'm here with Dr. Kerry O'Connor. We're going to take just a short break to hear from our sponsor, the National Health Association, and we'll be right back.
You're listening to the NHA Health Science Podcast. Dr. Frank Sabatino here. Are you ready for an extraordinary adventure that combines relaxation, exploration, and vibrant health? Then set your sails for the NHA plant-exclusive cruises. Imagine cruising through exotic destinations, savoring delectable plant-based cuisine, and engaging in rejuvenating activities, all while surrounded by like-minded individuals passionate about health and wellness. These cruises offer more than just a vacation. They offer an opportunity to immerse yourself in the NHA's principles of healthy living. And they rank incredibly high on the ratings of eco-friendly cruise lines. We all know how important our oceans are, and our cruise partner, Windstar, is fully committed to this. Join us aboard our upcoming plant-exclusive cruises and experience the synergy of health and leisure. Delight in gourmet SOS-free meals prepared by talented chefs. Attend informative workshops and enjoy the serenity of the sea, all tailored to nourish your body, mind, and spirit. For more details and to reserve your spot on our next adventure, visit healthscience.org and click the link under travel. Don't miss this chance to indulge in a wellness retreat like no other. Elevate your well-being and make memories that will last a lifetime. And remember, your feedback matters. Please take a moment to leave a rating and a review wherever you're listening to the NHA Health Science Podcast. I'm Dr. Frank Sabatino, your host. Now, back to the show.
Welcome back to the Health Science Podcast. I'm your host, Dr. Frank Sabatino, and my special guest is Dr. Kerry O'Connor, who is a member of the Love.Life Telehealth service and has spent a lot of time in her own path really integrating plant-based nutrition in the care of a wide range of problems and chronic diseases. When I was reading, again, about some of the things that are of interest to you, one of the things you made the point about, and of course it's empirical and it's very, very important, was that you talked about the fact that the results that not only you saw in your patients, but the ones that you saw within your own lifestyle were quite revelatory for you. Can you share some of what that's about and let people know how that played such another integral part of driving your path?
So that's a great question. And yes, when I went to Edinburgh, right before that, I had being in the military annual physical, and I'd had some cholesterol done and all of that. And about 8 or 9 months later, I had the panel done again. And this is after I had committed to going whole food plant-based. Didn't particularly have high cholesterol, although my numbers were in line with what the current recommendation is. Your total was around 200, LDL around 100, which we know now to prevent reverse heart disease, it needs to be much lower than that, right? So our total of 150, primary prevention 50 for the LDL, secondary prevention 30. And when I had gotten my labs done, I compared them side by side and I was shocked. They had dropped just incredibly. And they were all within the ranges that you should be, that we know now for preventing and reversing heart disease. So that was my first aha moment. And then I began to see it on my patients. I actually had one patient in the fall of 2014, I'll never forget, and type 2 diabetic, A1C of about, I think it was 13.1 or 13.2. And I had talked with him about a plant-based diet, and he had done it for 90 days, and his A1C dropped to 5. So it was shocking. And I'll never forget him because he said that he couldn't eat potatoes. And I said, why? And he said, well, because you told me not to eat anything with a face, and potatoes have eyes. So
That's very funny.
So I always affectionately remember that. But it works. And it works. It requires discipline, and the more you do it, the easier it gets. But I just kept going from there. So, and it's been a journey. I mean, I've 10 and a half years now into this, and I'm still learning. I learn all the time.
Well, Keary, talk about your evolution for taking the role into the telehealth platform, because obviously you've practiced face-to-face medicine. You've helped people that way. There are some people that would argue that the telehealth platform cannot do all of what that does, that kind of touchy-feely face-to-face stuff. Talk about why you moved in that direction and how it's really kind of worked out for you.
So face-to-face is great. There's no substitute for face-to-face. You can put the stethoscope on somebody's chest. You can look at their countenance. You can look at how they're walking in. You can check their skin, their eyes. There's so much you can do. However, with modern medicine and the productivity models now, most people are focused on the computer, not on the patient, right? So oftentimes it's data entry, oftentimes it's, reconciling med lists, reconciling their past medical history, current diagnoses. So you spend very little time actually face-to-face with them.
Right.
And then the time in the visit is shortened and it's truncated. So you have a 20-minute visit with that patient, but they come 5 minutes late. And then it takes another 10 minutes for them to get their vital signs and get in the room. So you might have 5 or 8 minutes with them. And I find on the telehealth platform, which I love, 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 is spending time with the patients. It's kind of like slow medicine for me because I have a chance to dig into their background, and they fill out a fairly comprehensive background history and intake form for us. And many, many times I'm able to pull things out that I can still do, I can still do online that I could have done in a primary care office. For example, I had one recently, and a woman, I had talked to her in the visit. I said, maybe when you go see your primary care, talk with them about this. And she did, and it fixed her issue, right? And so there are things that I can pull out of those intake forms. So it's not just talking with them about a whole food plant-based diet, that's part of it, but we hit all of the tenets of lifestyle medicine. And then my role as a family practitioner, family practice doctor, I can't put a lid on that. It's always going to be there. So I will do what I can, even though I might not be able to put my stethoscope on their chest. There are times people have said to me, one gentleman in particular, I have this twinge. And I said, please, you need to see a cardiologist right away. And he's like, we talked about it back and forth, and he had some ideas, and I kept pressing, said, please, please, please go see a cardiologist. So within a week, he had like a triple bypass surgery.
Wow.
So, I don't abandon my family practice training. We're still treating the whole patient. It's just different, but I have anywhere from 30 to 60 minutes with each patient.
Well, it was interesting to me because when I read a little bit about how you were describing the process, I know part of how you educate is to help people really regain their autonomy, really take charge on their road to health so that they can address the root causes, so they can address the barriers to, the outcome of that. And what was interesting to me, you made the point that this kind of an approach also gave you a certain kind of autonomy. It gave you an opportunity to create less than just a cookbook approach, right, where you could really develop a more diverse kind of lifestyle interventional approach within the context of your own freedom and your own ability to kind of be opened up to this process. Talk a little bit about that too, if you can.
Well, I think for the first time in my life, I don't have chest pains, and I don't have a lot of the physical stress that I had being in a brick and mortar location. And I don't have a lot of the fears and the worries and the anxieties. I have a very supportive team. We meet every 2 weeks. There's a group of 10 of us physicians. We've got a great support staff, and we meet and we share cases. We have a communication thread on WhatsApp, and people are throwing articles up there all of the time. So I feel like I'm in a collaborative, supportive environment, and I never felt that in brick and mortar medicine.
Nice.
And that to me is really important. It takes a team, it takes a village. And I feel like I've gotten my own confidence back. I feel like I have less anxiety, and it's made a world of difference. And I've also able to really spend time. There's many times in a 30-minute visit, I'll give the patient 45 minutes and I don't charge them the extra 15 because there's something important that needs to be addressed. I don't have to worry that there may be 3 people in the waiting room, right? I don't have to worry about trying to work somebody in. I'm always happy to work somebody in, but I know that time that I've carved out for that patient is for that patient, and I give them that and then some.
Yeah, I think most people out in the audience can resonate with the fact that that's just not happening. Right. In typical office practice, what you just described.
Right.
You've got that 3 or 4 minutes sometimes, and then you're out the door, and people can be so incredibly frustrated. Before we move much further along, where is a good location that people can find you? What's a good URL, a location where they can follow up and maybe make an appointment with you, get on the telehealth service? Give us that address if you can, please.
It's Love.Life. That's simple. And you'll see on the top, you have an option to look at all of Love.Life's or Love.Life's offerings, including restaurants. And then there's a little tab for telehealth. And you can just, you can go to Love.Life, I think, /telehealth, and it will take you right there.
I want to ask you this question, because many times, even if you're just face-to-face in an office practice, the idea of compliance and consistency can be very difficult. And I know you've emphasized the importance of being consistent with these lifestyle modifications, especially incorporating plant-based choices into their lifestyle. So how have you seen that, and how have you been able to reinforce that in the platform that you've chosen to work? And have there been some shortcomings with that? Or do you find that the people that come to you are already a bit of a captive audience, and so they're really kind of more open to that path anyway?
Great question. So I have patients that run the gamut who are a little bit plant curious, or they're like, I still want to eat, Sunday roast with, the family on Sunday, but the rest of the week I want to get better, to people who have literally been through every program, read every book, have been, to every website, and they've tried it all. So I really get a range. I think where my strength is I try and peel back the layers of the onion to get to the basics, to get to the foundation. Because sometimes when people have tried so many different things, they'll stick with one thing for 2 or 3 days and they're like, well, that didn't work. And then they go to something else for 2 or 3 days and that didn't work. So I try and bring it down to the basics and let them know that it's the consistency over time. Pick a path. I will do my best to support that path you're on, whichever path it is. If I see that there's danger signs or warning signs on that path, like it's not supportive of your cardiometabolic disease, I will state that. But I do understand that every patient has a right to their own self-determination, and my job is to kind of guide them. And there are sometimes that we don't agree, but I will do my best to support them, and I will do my best to support them with the numbers, with where they're at. And if we need a medication, we'll add a medication. If we can take one away, we'll take one away. But ultimately, I'll let them know it's those small decisions that we make every day, the consistent ones, that are going to get us to the goal. And it takes time. And I've often said that, there's a lot out there where like sexy sells, but if you really look at it, it's the sort of the mundane decisions that you're making every day. It's that tedium of every day. It's the consistency and sort of the for lack of a better word, sort of like the boring, unsexy part of health that really gets you to the goal, right? It's getting up and making that commitment to yourself to, whether it's meditate or walk and meditate or go to the gym or get your neighbor and say, let's go for a walk, or walk the dog when it's raining when you don't feel like it, to butt first greens or butt first an apple. If you're craving something or you're hungry, put that on the refrigerator. I'm going to do this first before I do that. And it's ingraining that into your lifestyle every single day. I have to do the same thing.
Yeah, we all do. Let me ask you a question, because I'm assuming that your clients, do you become their primary care physician, or do they still maintain physicians that they have at home that they see in person?
I always recommend that they maintain somebody at home, because if they are in a crisis or in an emergency, they have somebody that knows them. Many times I will work with their primary care. There's a lot that I can still do, and I can kind of meet them in the middle. And many times their primary care physician says, yep, we support what you're doing at the Love.Life Telehealth. That's great. Continue doing it. So we'll share notes back and forth. So it can be very collaborative. And in that case, the patient wins every time.
Well, that leads to the question. I want to question any potential conflict, because many of these physicians are not going to be on board with the idea that these problems that their patients have are actually not only preventable, but actually reversible. Right. So now you're teaching a certain model. So do you find any conflict that happens with that?
I have not had any pushback from a physician per se, but what I will get are patients that come to me frustrated, wanting me to help them find another physician because the current physician or specialist they're with doesn't get it. But oftentimes I'll try and work with that patient to help them educate their physician. I will say, here's some websites they can go to, here's some literature. But I find some people just don't want to take the time to do it. Some physicians and some providers don't, and they're busy. They have, a well-worn path that works for them. And so I can't fight that battle, but I will try and educate the patient and do what I can.
But in that education, something magical happens, because if they apply what you're teaching, they no longer need as much blood pressure medication to lower their blood pressure. They no longer need as much blood sugar lowering medication. So their home physician almost has no choice but to address the fact that something's changing. You can't keep the same level of medication without harming someone. So that's kind of a magical process in itself for these patients. Right.
And that's a good point when you talk about medications potentially harming patients, because there are times when I will say, we need to cut your insulin down, or we need to cut back your blood pressure medication. And they're like, well, my doctor's not ready to do that. And I know of a particular case, it was not a patient of mine, but it was a good friend who, diabetic, went almost, I'm not sure 100% whole food plant-based, but drastically changed their diet. And when they left their house, their blood sugar was 140, took their insulin, and the next thing they know, they woke up in the ICU because they had had a motor vehicle accident, right? Fortunately, everybody was okay. The person made it through, but it's dangerous because your blood sugar can change so rapidly, so quickly.
One of the pillars of lifestyle medicine, as well as what happens in the National Health Association, is the idea of really stress response management. And, for me, it's been many years where I have been involved as a teacher of Tai Chi, Qigong, and I was very impressed with the fact that your kind of background athletically led you into yoga and that you then got certified in several levels of pranayama yoga. And when I was going even a step further, I noticed that you're such a major proponent of breath work.
Yes.
So share a little bit with our audience the importance and power of really looking at those kinds of mind-body interventions as part of the big picture.
Great question. Yes. And great point. Most people I find are not comfortable being still. To get someone to stay still for like 30 seconds, right? It's very difficult, or to get them to focus on an activity. Social media and the way the internet is now and the way our lifestyle is quick sound bites. People are everywhere. We really need to bring it in and center, and it's a great way to quiet the mind, to calm the mind, but also to let our bodies begin to heal. And then we can begin to listen to that inner voice. Our intuition can come up. And then we're going to, once we resonate with that, once we begin to appreciate that and embrace that, we can begin to see the danger signs and warning signs of things that we should or should not do, right? We can get an intuition, we can get a feeling, we can say, oh, maybe I need to say no to, Johnny's invitation, or, Mary's thing, or maybe I shouldn't take on this extra project. And I know for me, when 2024 particularly turned around, I made a commitment that I was going to be doing this more every day. And I've kept a log and kept a calendar. And I realized that I had signed up for a lot of different classes and programs. And then I made a list of everything I had not yet accomplished. And is it going to serve me and serve others? Great, I'll finish it. If not, I'm just going to get it off the list. And ultimately coming into ourselves, right? And honoring ourselves, not harming ourselves. Ahimsa is one of the tenets of yoga, non-harm. We then can heal ourselves so we can begin to serve others. And that's really the benefit. And that's the purpose of yoga, right? Is we come together, and yoga is, so we can learn and serve others. Yoga is not about a pretty pose or a pretty posture. And as one of my yoga teachers said recently to me, it's not about standing on the floor in a forward fold with your hands flat on the floor. It's what happens on the way down to the floor, right? It's that journey. And so I think for me, one of the things I'm trying to incorporate much more now into my visits with patients is addressing stress. And I find that that's the one that I have the most resistance to with patients.
Well, do you teach any of that online, or is that something you do just private practice for you now?
I do it. I haven't done it online yet. I've done it with our group of physicians, and I do it individually with some patients, for sure. And I'm doing a little bit with my group. I'm doing some more advanced yoga training, and I'm doing it with our group a little bit more. So slowly but surely, yes, eventually.
And we talked about the importance of breath work. I noticed you emphasize something called resonance breathing. Talk a little bit about that.
So resonance breathing is great. It can really help improve your heart rate variability. And we know with improved heart rate variability, we can improve things like blood pressure, right? Anxiety levels, cholesterol levels. And I know Nick Keith from the Breathing Diabetic has improved his blood sugar level, right? It's amazing. And there are plenty of apps out there that you can use, but it's a very simple breath technique where you inhale for a certain number of seconds, whether it's 4 or 5 or 6. But the goal is to make your exhale about 2 seconds longer. Right. And many people will breathe into their chest and they're like taking a deep breath in, but really you want that breath to be in your belly. You want, we know physiologically the air is never going to get in your belly, but you want to visualize and understand that diaphragm is moving down as you take that air in and the belly's moving out, right? And then this reverse, when you exhale, that belly's coming in, the diaphragm is raising. And you want to kind of visualize that and really focus on that breath, and tremendous benefits for stress and anxiety.
No question. In the Taoist system that I practice, we practice something called longevity breathing. We would get down to the point of having 2 to 3 breaths a minute. And when you're at that state, there's such a parasympathetic activation that the whole system just...
Yes.
And it brings all of that down. So I was very pleased and excited to see that that's something that you see as important in what you do. Let me ask you a question. In terms of support, we know that having the care that you're providing, of course, is remarkable and important. But we know when we look at long-lived cultures that having that sense of community support is such a big factor. Does the telehealth service that you're involved in, do they do any kind of group like cooking classes or shopping classes, or do they reinforce any kind of community connection outside of the platform of the telehealth consultations?
We are working on that, actually. So we've had several ideas proposed. We were acquired about a year and a half ago. We were plant-based telehealth and then acquired, rebranded as Love.Life. So the organization is growing. We're in our infancy stages, and several of our docs will do different things within their own sphere, but we are starting to come together and work on some programs, and we've got some things in development.
Yeah, in terms of the telehealth service, so do you have to only operate within the states of licensure that you're connected to? Is that how that works?
Yes, and that has to do with medical malpractice. So I'm licensed in 12 states. I have a 13th one coming on board. A couple of our docs are in 23 or 25 states. We have all states covered. We have one, we're just waiting for the license to actually be issued, but that everything's complete. So we are, and that's the state of Delaware. But as of right now, we are covered all 49 states, and then we do some international work as well.
Well, I know your organization very well, and I know the NHA is trying to be connected more and more with it, especially through the auspices of Anthony Maziello, who's an old friend.
Amazing.
And just a remarkable human being. So
yeah.
I'm so pleased that we're connected, and we're going to highlight more and more of the people in your service, which is going to be a really great and beautiful thing to do. As we wind this down, do you have any final words or ideas or thoughts that you would like to share with the audience out here?
I would just, two things. First, I want to thank you, Dr. Sabatino. Thank you for this opportunity. And I really appreciate what the NHA does, the natural hygiene history, the National Health Association, the conferences, the people that you bring to your conference in Cleveland or Independence, Ohio is amazing. I mean, it is the luminaries. It is, I call them the rock stars. I met Brenda Davis there a couple years ago, absolute rock star. So it's incredible what you do. So keep doing it. And I appreciate everything that you do and the resources that have helped us. And then I just say, have patients give us a try. We have an incredibly talented team of physicians. Some have written books, some have been in movies. One is a professional chef. The talent is just incredible. And I feel so blessed and so fortunate. And I've learned from them every day.
And I really want to thank my guest today, Dr. Kerry O'Connor, for sharing her words of wisdom, her insight, her heart. And I urge our guests to really seek her, follow her. If you need the kind of care and the personal care and touch that she provides, I urge you to seek that out. Again, the location of her, where she's working, will be in our show notes, and you'll see those, and you see them underneath. And I also want to thank all of the people that joined us today. Without you, we can't do what we do. And I want to really thank you for being part of this really active, beautiful, healthy community. And on behalf of the National Health Association, I'm your host, Dr. Frank Sabatino, and I look forward to seeing you on the next episode of the Health Science Podcast. Thank you so much.
You've been listening to the Health Science Podcast, brought to you by the National Health Association. Thank you for joining us today and for your commitment to evidence-based health science that backs a whole food, plant-exclusive lifestyle and contributes to the well-being of all people, animals, and our environment. I'm your host, Dr. Frank Sabatino. Be sure to leave a rating and a review, and we'll see you on the next show.